Despite the numerous amounts of benefits for mother and child, Black women have the lowest breastfeeding initiation and duration rates. That's according to the CDC. Better Black News will be speaking with local Black lactation professionals to find out what is going on in our community. Farrah Mayberry, you work with Epiphany Birth Services and you're able to work with other moms and everything to support them. Can you explain why you think breastfeeding is not knowledgeable in our community? Do you think it's a historical thing or what?
I think in reference to breastfeeding rates of initiation and sustenance in the Black community being low, I do think that history plays a part.
How so?
I think that there was a time when, as a Black woman, you might be nursing your baby and also your master's baby. I think that also historically, just in this country, there have been times when breastfeeding has been less popular because science was more popular. I think there have been times when formula feeding has been kind of like the status symbol of like, you can afford to buy formula. And I think at this day and age, it's kind of the opposite.
Despite the many benefits of breastfeeding, I know as a nursing mom myself, while I was pregnant, I was doing my own research because that's what I do. I mean, I'm a journalist. Hello.
Right.
I was learning about all the benefits of breastfeeding, and it was just mind-boggling to me how many things are great for me and my son. And I'm just like, why are more women not on this bus? What is going on, especially in our community? You know, can you explain more about the benefits, from a professional standpoint, the benefits for mom and baby?
When you get pregnant, you automatically, milk is going to form in your breast, whether or not you want to breastfeed or you want to formula feed. So it makes sense that, the natural thing to do is to breastfeed your child. The milk that you produce is perfect and it's ideal. It's the ideal nutrition for your baby. The milk also helps to protect your baby from different types of illnesses and diseases, things like diabetes, even viruses and colds. The saliva, your baby communicates with your body through his or her saliva so that your milk can change. Your breast milk changes on a daily basis. Formula does not. For the mom, it also has benefits. It helps with the process of uterus contracting after baby is born. It also helps moms with depression, with postpartum depression. It's just a very unique bond that you have with this baby. It also helps to reduce risks of diseases in moms as well in terms of breast cancer and ovarian cancer. So the list of benefits is way longer.
Let's talk a little bit about formula from a history standpoint. Throughout history, if a woman was unable to produce milk for her child, or if the mother died leaving an orphan needing to be fed, the child was supplied with a wet nurse. That is, a woman who breastfeeds another woman's child. Wet nursing was a common practice before the introduction of the actual feeding bottle and formula. If a wet nurse could not be found, a child was subject to starvation and malnutrition, being fed animal's milk through dry nursing. Lack of human milk literally meant life or death to infants up to the early 1800s. As early as 1846, scientists and nutritionists made the medical problems and infant mortality associated with dry nursing a priority and set to work coming up with the world's first baby formula. This news story is not meant to demonize formula, but to just properly inform. We are fortunate to live in a day and age where babies are no longer dying of malnutrition and starvation if their mothers can't breastfeed. As an emergency measure, formula is and always will be literal lifesaver in the absence of other options. But exclusive formula feeding does have its serious flaws as a sole source of nutrition. And, as I hope this news story will illustrate, formula was never intended to be eaten as an everyday infant food, except in extreme emergencies. Babies need the live food of human breast milk. Breast milk contains living cells, hormones, active enzymes, antibodies, and at least 400 other unique components. It is a dynamic substance that provides active immunity and protection from disease every time a baby eats. Infant formula is the only manufactured food that humans are encouraged to consume exclusively for a period of months, even though we know that no human body can be expected to stay healthy and thrive on a steady diet of extremely processed food. Baby formula was never intended to be consumed on the widespread basis that it is today. Rachel Nelson, you work with your own business as well, Mama to Mama LLC, where you're able to help moms. Can you explain the role of a lactation professional, why someone would need to reach out to you? Like, what is your purpose?
Right. Yes, as a lactation professional, the way I see it is you wouldn't go to the dentist for a stomach ache, right? You would go to the doctor. And so as a person in the lactation field, if a mom has issues dealing with lactation, it's important that she has a support system around her that understands what exactly she's trying to say or what exactly she may be going through. And with that, she can come to a lactation support system, as opposed to trying to go and find someone randomly who wouldn't necessarily have the knowledge as to what she needs to do or how she needs to go about it. So I feel like we're a very important role, especially in our community where there's not a lot of people who understand what it's like to breastfeed.
Can you give some words of advice, or what would you say to a mom who's on the fence, who may be like, I don't want to breastfeed because that's weird, or breast are a sexual thing to me, that's what I use for my significant other, or nobody breastfed in my family, I'm fine. Like, what would you say to that mom on the fence, or who's just not interested at all?
Right. I think it's important for moms to know whether you decide to breastfeed or not, the milk is going to be there, right? So maybe let's find out, why they feel the way they feel. Is there something that people around them were saying? Because as you said, it's not common in our community as Black people. I myself was one of all of my cousins, the only one to be nursed by my mom, who was a sibling of 7. So I think it's important to maybe find out why you don't want to breastfeed. Why is that not interesting to you when it's something that our body is going to naturally do anyway? And then maybe just put the education out there. A lot of us just aren't educated on it. And if people around us also aren't educated, how do we get the knowledge? Which is, again, why our role is important, and why it's important to be surrounded by people who have been through it. Since the milk is going to be there, what if we just try? Let's see how this is. And after explaining the benefits and everything, there's a lot of times a mom will be willing to just try initially.
And it's free.
It's free.
It's free.
Yes, that's the favorite part. And you can be, there's no bottles. You can be lazy. Just whip it out. That's what got me started.
Breastfeeding continues to be beneficial beyond the age of 1. We have to continue to raise awareness in our community. For more information on breastfeeding, you can reach either Farah or Rachel with their information at the bottom of the screen. I'm Jillian Whitaker, reporting for Better Black News, reminding you to be better. It's okay. Don't trip. Don't trip. It's okay.
All right, do it again. Okay, benefits.
All right, all right. I hope you got something out of that video we just watched, found some value in it. I am Sakisa Berry. I am the founder and the executive director of the Georgia Black Doula Network, and I will be instructing this breastfeeding basics class. Thank you so much for joining the Pregnancy Informational Circle and Learning series. It is a free series that we try to offer to the community at least twice a year. It is virtual. It is offered anywhere there is a Wi-Fi capability. So be sure to share it with anyone that you know that may be interested in learning more about their pregnancy, birth, and beyond. So without further ado, let's just dive right into it. Why breast is best and how to feed. We're going to touch on several different topics and tips within this discussion, and I'm just going to move fluidly through it to help you better understand the mechanics of breastfeeding and some of the resources you can use to have a more efficient and fluid breastfeeding experience. So before I dive in too much, I just want to give a little background on myself. I am a community midwife. I'm based here in Metro Atlanta. I live in the city of Jonesboro, Georgia. I've been a community midwife for about 10 years. Prior to that, I was doing dual careers, 2 hats, doula work and lactation work. I actually ran lactation clinic for about 3 years, and I also worked as a peer counselor in for WIC, Women, Infant, and Children, at my local health department here in Clayton County. I did that between the years of 2010, 2013. Received my certified lactation counselor credentialing and then moved on. At that point in time, I was able to teach classes and offer consulting within different midwifery and obstetrical offices. So I worked and ran clinic in about three different offices between the years of 2013, 2016, before I stepped officially into my midwifery role. So I also have a lactation book that I put out. I'll be sharing a little tidbit of details about that towards the end. You can solicit that if you so choose through my website, Love and Touch at loveandtouch.com, Loven touch.com. All right, that's my shameless plug. Let's dive into it. Okay, so the breast choice, right? So experts agree that breastfeeding is beneficial for healthy infants' development, right? Some mothers exclusively breastfeed, while others choose to express and bottle feed breast milk. It is all good, all right? Successful breastfeeding is a combination of practice, good techniques, support, and education. And I like to add, I said practice, I'm sorry, patience, but I like to add practice. The practice, patience, persistence in order to, especially if you've never done it before. And even if you have, sometimes those veteran moms, parents still may have issues breastfeeding that newborn because every new baby comes with their own personalities. So you just have to be patient with them. All right, so in this blue area at the bottom, we have experts recommend that children be breastfed within 1 hour of birth, exclusively breastfed for the first 6 months, and then breastfed until the age of 2. Yes, to the age of 2. Artificial feeding is associated with more deaths from diarrhea in infants in both developing and developed countries. So don't think that just because we live in the United States that it can't happen to your baby, right? Like I said, I used to work for WIC and I saw my share of infant challenges. I'll put it that way. Infant challenges as a result of using infant formula. So, you definitely want to move with that one in caution, especially with all the recalls and things we've been seeing as of late. Moving on though. So signs of breastfeeding readiness. Too much is on my screen. Let's move this over here so I can see better. All right, signs of breastfeeding readiness. All right, so during pregnancy, sometimes people will have some concerns about whether or not their body will be able to produce milk. I have mothers often get concerned, especially if there's a first-time mom, when they don't see any crestation around the nipple or they don't have any dripping of fluid from the nipples, because this is something they may have come across either in a book, an app, or on social media. And trust, know, and believe it is perfectly fine if you do not see either. It is not an indication of whether or not your body can produce milk. Let's be clear about that. All right, but what we do typically see as early as the 16th week of pregnancy, most women feel a difference in their breasts, right? They usually feel a little sore. They may feel a little fuller, more tender to touch, things like that. That's your breast preparing themselves to make milk, right? The nipples may even become darker and widen, and the Montgomery glands, which is those little pimple-like regions within the areola, may become more prominent. They may look more like pimples, even like little small pimples around the nipple. All of this is your body preparing itself to breastfeed. By the second trimester, the body is fully capable of producing breast milk. This means that a premature baby will still have the option to nurse. So most hospitals in this country and abroad understand that breast milk is the best milk, not only for all babies, but certainly for premature babies. And your body knows this. So if you have a baby somewhere within that second trimester, specifically more like 22 weeks or so, you should already be able to have colostrum producing capabilities within your breasts. So that's what we're talking about here. Some moms will find yellow orange stains in their bra. As I mentioned, colostrum, this is an early form of breast milk. So we'll talk a little bit more about colostrum as we move forward. but that's those people that are seeing some leaking or some crustaceans around the nipple. As I mentioned, everybody don't see that. Keyword here being some moms. Not all moms will experience that. Okay. After labor, babies are born, most babies are born ready to breastfeed soon after birth. Full-term babies, we should put that in there. Most full-term babies are ready to breastfeed soon after delivery. It's recommended to form that bond within the first hour, hence that first slide saying experts recommend initiation of breastfeeding or latching your baby, if possible, within that first hour. Unfortunately, so many people have C-sections now, and that first latch is very disrupted. By the time mothers receive their babies after they've had a C-section, it's anywhere between 2 to 4 hours after birth. And that's if there were no complications, right? And by that time, babies are usually very, very sleepy. There is a physiological effect of adrenaline that takes place abundantly at the onset of delivery, right? And the mother receives this abundance of adrenaline so that she can push her baby out. That adrenaline is shared with the baby, and that adrenaline lasts in both of their bodies for, on an average, about 3 hours. So anywhere between 3 to upwards of 8 hours, you can see that most cases, by 3 to 4 hours, though, that adrenaline has fizzled out, and mom and baby are very tired. And babies typically go into this coma-like sleep for as long as 4, 6 hours, some cases, again, even 8 after that window, which can be very challenging to wake them up to try to breastfeed within that time period. Many mothers will have to wait until they're more actively alert, and that can be anywhere upwards of 10 to 12 hours after birth in some cases. And that can be when the baby is very hungry or very alert and irate, which can cause problems for those initial latches. So we do see that domino effect too often, too often. So in the hospital, you definitely want to make certain, if you're birthing in that space, that someone is available to help assist you with those first latches, if possible. Okay, from breast to baby. All right. So what this first image is kind of showing you is, it's called the positive feedback loop, right? Many times mothers will be concerned about milk production. And the best way to produce more milk is through stimulation. It is tried and proven. I know many people will look into the teas, the supplements, the different foods and things that they'll select to eat to try to increase their breast milk. And those have their place, right? They can certainly help you with your nutrition, if nothing else. But what is tried and proven here is stimulation. So what you're witnessing is the baby is suckling, it stimulates, it sends a message. They're calling it a sensory impulse from the nipples. It's sending a message to the brain and to produce oxytocin. Then oxytocin floods the bloodstream and it makes more milk. And so this also increases uterine contractions, something to be mindful of, because um, if even if you've breastfed before, like even if this is your second, third baby, you may not have experienced those postpartum contractions, right? The cramping with the first baby. It's more common to experience it with the second, third, and so on. Those repeat pregnancies is more common to experience the postpartum contractions because the uterus has to work harder to involute or to stay firm. And it's so important that your uterus stays firm to avoid hemorrhaging postpartum, which is one of the beauties of that symbiotic relationship of breastfeeding. Because as the baby is stimulating your nipples, it's triggering oxytocin. Oxytocin is the natural form of Pitocin, which you may or may not be introduced to in the hospital. It is a drug used to induce labor. It makes contractions stronger because it forces the uterus to contract, right? And so it's emulating oxytocin. Sometimes the bag that they hang in the hospital on that IV drip, it may even say oxytocin on it, but it's Pitocin. And that's exactly what it's designed to do. So it's designed to help prevent hemorrhaging postpartum because that your placenta, where it was attached to your uterus, now where it peels away and comes out of your body, it left behind an open wound inside of your womb. And that open wound can have capillaries and vessels that need to heal. They need to be, they need pressure, like applying pressure to a wound. Like if you had a cut or something somewhere else on your body, you immediately would put a tourniquet on it or you would apply pressure to it. That's why we wear the postpartum belly bands, right? To help avoid hemorrhaging postpartum. So that is so important that you are very intentional about how you care for yourself in that postpartum, which we will have a class about postpartum, I believe, coming up. It follows the breastfeeding basics class. The next one should be postpartum recovery. And in that particular class, you're going to learn a lot more about how to care for yourself and avoid being rehospitalized after birth. So for this one, just be mindful of that's why the body is producing that oxytocin. It helps to push the milk out of the body. It also helps the uterus to contract and stay firm, which can cause some postpartum contractions for you. Nobody told me that, but it is so important to know because it can catch you off guard and it can be very uncomfortable. But it does have a purpose, and wearing a belly band can reduce that sensation some. All right, so another concern that parents typically have when they're breastfeeding is my baby getting enough milk, right? I don't know if my baby's getting enough milk. I hear that a lot. So just understand that your baby does not require much milk the first day or so after birth, right? Don't feel like you need to fill up a 4, 6, or 8 ounce bottle immediately after birth. I don't think anybody can do that. I've never seen it. Maybe one person out there in the world, 2 or 3, but it is not the norm, okay? The norm is that your body is producing colostrum in very small amounts. Colostrum comes out in drops, just drops. It is very thick and sticky substance and is challenging to pump. This picture doesn't really do a good job of demonstrating colostrum. This first bottle really should have had like more of a yellowish hue to it instead of white. But as you see here, the baby's belly size is about the size of a cherry, very small on that first day or two. And they can only hold about 1 to 1.5 teaspoons. Not much at all, right? On day 3 is when we'll see that belly stretch. What's really happening is the muscles in the belly are really tight the first couple of days. And after 72 hours or so after birth, the muscles in the baby's belly start to relax. And now they can hold more. Now they can hold upwards of 1 ounce, anywhere between 1/2 ounce to a full ounce, which means the baby's belly is about the size of a walnut, right? In the shell. This next picture is a small, maybe like a tangerine or so. So that first week, 7 days or so after birth, they can now hold upwards of 2 ounces, right? Before that, they cannot hold at 2 ounces, y'all. Not per feed, not per feed. Now, granted, breastfed babies typically will nurse several times a day, really because their belly sizes are so small and they can only hold so little at a time. But this is everything in nature when it has its purpose, when you follow the process, right? Babies have to learn how to breathe, suck, and swallow. They don't know how to do this initially. They first have to learn how to breathe, right? They catch on really quick. They come out, take that first breath, they're crying. Okay, all of that is it causing their lungs to expand and they're learning how to breathe. Once they learn how to breathe, then they can latch. They latch onto the breast, and now they have to understand how to suck and swallow and breathe at the same time. Takes them about 3 weeks to master this, right? It takes our bodies 21 days to learn or break a new habit, right? It takes babies about the same amount of time to hardwire the muscle memory in their bodies, in their brains, about how to latch onto the breast and effectively and efficiently remove the milk. So even though that baby may be on your breast 30 minutes, 40 minutes, they are predominantly breathing. And then they do a few sucks and they get a little reward of drops of breast milk, which is power packed with antibiotics, antimicrobials. It has a laxative in it to help them have those first bowel movements. It is a powerful substance. Do not underestimate colostrum. Every human needs it. So the first few days, upwards of the first week, your body will be producing colostrum. About 3 to 4 days or 72 hours or so after birth, your mature milk starts to come in, and it will be blended in with that colostrum. So you will produce more milk. Hence, the baby's now ready to consume upwards of about an ounce or so per feed. And I want to be intentional in sharing that this newborn behavior is more common for a baby between 37 and 40 weeks. 41 and 42-week babies have their own feeding pattern. They typically may be more hungry, to be honest. And these are parents that I encourage to do some colostrum harvesting, where you can have a few ounces of breast milk on standby in case you do go post-date. You're upwards of 41 weeks and you're dealing with a very irate and hungry baby. All right. So it's not until that baby is almost a month old that they can even hold about 4 ounces or so. So even here it's saying 2.5, upwards of 5 ounces, right? So what I have witnessed many times over is an exclusively breastfed baby typically will not exceed a 5-ounce bottle. I think this one is 5. Yep, this is a 5-ounce bottle. They typically will not exceed this. Most exclusively breastfed babies, whether they're 6 months, 8 months, they are still doing about 4 to 5 ounces per feed. And then, on top of whatever solids that they may be receiving as well. So don't ever feel like you need to pump 8 ounces at a given session of pumping to appeal to your baby. Okay. Actually, before we go on to this one, I want to take a pause and share a video with you all.
When a woman becomes pregnant, her body undergoes hormonal changes, primarily influenced by 2 hormones, estrogen and progesterone. These hormonal shifts prepare the breasts for milk production. Shortly before childbirth, another hormone called prolactin, which is responsible for milk production, increases in the woman's body. After delivery, when the baby begins to suckle at the breast, it stimulates the nerves in the nipple and areola, sending signals to the brain. Within the breasts, there are small clusters of granular tissues called alveoli. These alveoli are responsible for producing milk. During pregnancy, under the influence of hormonal changes, these alveoli begin to multiply and enlarge. By the time the baby is born, the mother's breasts have around 150,000 alveoli in each breast. This is many times more than the number of alveoli that a non-pregnant woman has. Inside each alveolus, there are specialized cells called secretory cells or alveolar cells. These cells are the key players in milk production. They produce and secrete milk components such as proteins, fats, lactose, and immune factors. In response to the baby's sucking and nipple stimulation, the hormone oxytocin is released from the pituitary gland in the brain. Oxytocin triggers the letdown reflex, also known as the milk ejection reflex. This reflex causes the muscles around the alveoli to contract, pushing the milk into the milk ducts. And out through the nipple. Breast milk production operates on a supply and demand basis. The more frequently and effectively the baby nurses, the more milk is produced. When the baby empties the breast during feeding, it signals to the body to produce more milk to meet the baby's needs.
Okay, so despite that dated video, I always say that was the prototype for the AI, right? The AI graphics in that, but it gives you a good visual. The information is still solid. It's still relative today. So you got to see that positive feedback loop I was referring to. There will be a link to this video connected to it in the content below. So you'll be able to refer to it and see it in its entirety, watch it in its entirety if you choose. But we just wanted to give you a visual of how the body actually is producing the milk. All right, so moving on. We have securing a good latch, right? This is the part where many people struggle and many people give up. They start trying to breastfeed, and then for whatever reason, the baby's hurting the nipple for various reasons. There's so many different reasons why this latching can go wrong. And so ideally, to secure a good latch, I have a video to share for that one as well. A very short video to help you understand the mechanics of it. And so some of the things that I see people doing wrong is you see here, actually the way this baby's head is being held right here at the crease of the neck is not a good idea, right? And also this picture here, the way that she's holding the back of the head, I would say that's also not a good idea. If you are going to hold your baby at the back of the neck or the back of the head, you want to have a very gentle, wide hand hold, just a supportive hold, where you're just holding and supporting the head up. You're not forcing the head onto the breast. We all have what's called a biting reflex, and it's right here in the back of our necks. And so when you're holding that area, you can cause a very shallow latch. When we never lose this reflex, it's with us all the time. Whenever you try to fit something very large in your mouth, say like a large hamburger or a Subway sandwich or something like that, and you're trying to fit it in, you either swivel your head from side to side, or you will scrunch it down and lean your head back and go in that way. One way or the other, that biting reflex stays with us for our whole lives. And babies are no different. They have that reflex. They need to be able to maneuver their necks in order to latch on. So that's the only takeaway from the only thing that I don't really like about this image is it can be a misconception that holding the baby in this capacity is correct. And I discourage that. She has a firm hold on this baby's head, but the C-hole and supporting the nipple is perfect. That's how you want to support the nipple. You want to give the nipple some support. In this picture, there's no support on the breast at all. And again, the mother is forcing the baby onto the breast. The baby's lips, as you see here, are perched like a fish. That's not what we want. We need a wide mouth. You see the baby in the first picture, their mouth is very wide. That's the type of latch we want to see. So the first week of breastfeeding is a serious learning period for everyone that is involved with caring for the newborn. It's beyond just mom and baby. It's going to require patience for everyone around. So many people want to just put something in the baby's mouth to shut them up when they're crying. And I understand. However, we want to put it in there correctly, right? We don't want to just go and get in the habit of putting bottles and pacifiers in the baby's mouth to shut them up. We really want to understand why baby is crying, okay? Not every cry is the same. Some cries are just because they're uncomfortable, right? They may have peed or pooped, or they're hot or cold, or they may have an itch. Who knows? And then there's other cries that they just want to be held and they just want to know where you are. Somebody hold me, get me. And then there's also those cries of hunger, which for babies shows up somewhat painful. And you have to think about yourself. How are you when you hungry? Most of us deal with hunger, right? We get hangry. And babies are no different. They may have little headaches. We don't know. They may get stomach cramps. They may feel nauseous. There are a variety of reasons why babies may be stimulated to cry to signal their hunger. But there will be cues before that, which we will touch on, I believe, in this PowerPoint as well. So some of the things that can show up that can cause problems is difficulty latching might result in the use of formula supplementation. It can cause sore nipples, clogged milk ducts, and engorgement, which is the extreme fullness of your breast. So once again, I want to share a video, and I'm going to just show you. It's very short. It will demonstrate to you a proper way to latch your baby on.
Line up the baby's nose to your nipple. Touch the baby's top lip and wait for a big, wide mouth. Bring the baby's chin and lower lip to the breast. The baby's head should be slightly tilted back. Wait for baby to open his mouth wide, then bring him on, directing the nipple to the back of his mouth where it will be safe from harm. The nose should not be touching the breast. Notice the baby does all the work with the lower jaw and tongue. This is why he needs a big mouthful of breast and to be suckling on the areola below the nipple. If the nipple is not far enough back in the mouth, this can cause the nipple to be pinched and cause pain. It is also difficult for the baby to hold onto the breast. The nipple should be at the back of the baby's mouth where it is safe from harm.
All right. So as you saw in that video, and though it's really quick, like I said, they demonstrated an optimal latch for the baby. So ideally, as I mentioned there, you want to have your baby facing their food. They want to be facing their food, and they want to, that means their head should not be turned like this, right? They should be facing their food while you're supporting them. And whether that's in the cradle hold, where the baby's head is resting in the crease of your arm, right? Or whether that's the clutch hold, where the baby's body is wrapped around the side of your body, and they're looking upwards at you, and you're holding and supporting your breast and placing it in front of them. There could be cross cradle hold, where the baby is placed across the front of your chest, and you're supporting your baby with one hand and your breast with the other hand. So any of those positions, you want to make certain that your baby is facing their food, right? Because otherwise that can cause damage at your nipples, because when they suck, they're going to be slowly, if their head is turned, they'll be pulling against your nipple in a very uncomfortable manner, and it can cause some damage to your nipples. And then you also want to be mindful to aim for their nose. We're always so tempted to just put the breast all the way in their mouths, but the nose triggers what's called a gaping reflex, and it forces baby to drop their mouths and open it wide, and then you can place your nipple in their mouth. So it's like tempting them with the smell of milk by placing your breast towards their nose, and then you can lower your breasts directly into their mouths once they gape or open their mouths wide. So those are just a couple of takeaways to help you secure a good latch, and it shouldn't hurt. As it mentioned on there that the breast should land deep into their mouths. Most bottles work because the nipple is about 1 inch long. It's not because they prefer a bottle. It's because the nipple on a bottle is designed to stimulate a baby's sucking reflex, which is about 1 inch deep in their mouths, right? It's behind the soft palate. I'm sorry, behind the hard palate. The sucking reflex lives within the soft palate, which is behind the hard palate. You can feel it in your own mouth. You reach your tongue back, you can feel the soft palate behind the hard palate in your mouth. That's what the baby's sucking reflex is, and that's what bottle nipples do. They stimulate that reflex. Think about it. Why are all of them about the same length? This is why. Stimulate that reflex. It forces the baby to suck because it's a reflex. So your body can do the same thing. It's just making certain that your breast lands deep enough into the baby's mouth. There's enough breast tissue there. It's called breastfeeding for a reason, not nipple feeding. This baby at the bottom here, this image is a baby that's nipple feeding. This mom is going to be in a lot of pain. She's going to have all kind of soreness and bruising to her nipple as a result. Whereas this baby here is breastfeeding. As you can see, the mouth is wide and is covering a generous amount of her areola. That's the type of latch we want to see when we're breastfeeding. All right, moving on. Eating and resting is critically important for you to have a healthy milk supply and just enjoy the experience, right? So it is important that you rest and avoid extra activities while you are experiencing postpartum bleeding specifically. Again, we will touch on this.
This mother is in a laid-back position. She is leaned back slightly with her legs comfortably elevated and her arms and elbows supported with pillows. Her baby is sleeping.
So we'll talk about that a lot more in our next class. Eating in postpartum, sorry. Eating is important since the body burns an extra 500 calories while breastfeeding. So when you're pregnant, you're burning about, they say you're up to about 2,500 calorie diet. So with breastfeeding, they expect you to be up to about maybe a 3,000 calorie diet. And what that is equivalent to is about another half of a sandwich a day, right? An additional 500 calories. And this is just some extra intake you'll need to help your body produce enough nutrition for yourself and your baby. You also want to make certain that you stay on your prenatal vitamin. Continue to take your prenatal vitamin. If you lost a significant amount of blood during delivery, you want to start taking some iron supplement as well. Any supplement you take, it needs to be plant-based, right? Not synthetic. Those synthetic supplements will make you constipated. They can cause indigestion and headaches. You want to make certain that you're taking in a good quality supplement of prenatals as well as iron if you're required to take iron after delivery, okay? That ferrous sulfate iron is very harsh on our bodies. It causes our stool to be very dry and hard, and it constipates us. It actually does not do very well at boosting our iron levels in our body. Actually, you have to take so much of it in order to get the results that you want, and that's part of why it causes the problems, because it's so synthetic. You want to do a more plant-based iron supplement. You can find one on Amazon. You can find one in your CVS. Herbal health food stores will have them. It's worth the investment for your own body as well as your baby. Okay. So some snacks that you want to have. It's very popular as of late. People have these bedside caddies. They will get them from, I don't know, online, Walmart or whatnot. But those nightstand or anything that you have, you want to have some snacks and hydration close by every time you feed, right? Every time you feed your baby, you want to feed yourself something. That could be a handful of trail mix. It can be a bowl of fruit. It can be a granola bar. It could be a sandwich. It could be a salad, something. Try to think about things that would be nutritionally sound, as snacks in between your meals. Don't just snack on potato chips and I don't know, ice cream and things like that, because you'll still make milk. You will make milk and grow a fat, healthy, chunky, happy baby on junk food. But you are not going to be cute. It's going to impact you. You might lose teeth, you can lose hair, your skin will be dry. It will impact you in some very um, physical ways that, can also cause you to stop breastfeeding. So let's be intentional with how the foods that we select to snack on and ingest during our breastfeeding journey. All right. Another thing you want to be mindful of to have a great breastfeeding experience is your team. As I've mentioned in another slide, right? The first day or so, the first week of breastfeeding specifically impacts everyone involved with this newborn. And it truly does. And so you want to have a very supportive team. You want to make certain that your partners, your doula, the grandmoms, the grandfathers, the aunties, the cousins, the sisters, anyone that's going to be supporting you are also supporting your intention to breastfeed. It can really be discouraging if you have people around you that are telling you that you can't do it, you shouldn't do it, you need to just do something different, right? I know I heard those things when I was breastfeeding my first. I was told that, oh, them little bitty titties is not going to be able to feed a baby. Food them. I breastfed all four of my children a year and a half each. So they do grow to produce milk if you are in the small breast committee like myself. But but yes, you want to have people around you who are eager to share their breastfeeding stories, particularly if the experience was negative. You don't want to have, what's it? People will be, oh, I'm sorry, I read that so wrong. People will be eager to share their breastfeeding stories, particularly if the experience was negative. This is so true. Customer service one-on-one, people will tell a negative story 10 times over a positive experience. And so you don't want to hear that when you're trying to reach your goal. So remember to never adopt someone else's experience as your own. Avoid doubting your own capability. And you should surround yourself with breastfeeding supporters that encourage your efforts, right? You want people that's gonna, you know, provide resources if you're having issues. Maybe they know someone that is a lactation consultant or a breastfeeding counselor, or they have a friend that breastfed that they can refer you to, or they breastfed themselves. These are people that you want to surround yourself with. There's all kind of Facebook groups that you can plug into nowadays that encourage the breastfeeding journey. So these are the spaces you want to lean into for guidance and support. Even your healthcare providers, right? Most healthcare providers do encourage breastfeeding. You want to make certain that your pediatrician is breastfeeding friendly. Even ask your pediatrician, what kind of growth chart do they use? Do they use a World Health Organization growth chart that's in alignment with a breastfed baby? Or are they using the American Academy of Pediatrics growth chart, which most of those are in alignment with formula fed babies? So that growth chart makes a difference in how they will recommend your continued breastfeeding efforts. Working clinic, I've seen that where pediatricians are looking at their AAR, the American Academy of AAP, American Academy of Pediatrics growth chart. And again, this was over 10 years ago. And they would be referring to that and then advising my clients or my families, oh, you need to introduce formula, or you should stop, because your baby's too big, or you need to introduce formula because your baby's too small. I've heard both stories, and many times it goes back to the growth chart that they're referring to and measuring your baby against. So that's a great question to ask your pediatrician and understand what their capacity is for supporting you in breastfeeding. Did they breastfeed were their children breastfed? Do they have breastfeeding resources in the office? Do they have a list of local lactation professionals that can support you? Really really ask them questions. Really, you really want to that would be your go-to person, your pediatrician for inquiries about your baby. So you want to make certain that they align with your goals. All right, moving on. We're talking about supplemental feeding options, pumping and hand expression. Right, if milk is available, you can pump and give an additional feeding after your baby has fed directly at the breast. This is only as needed, right? But it's not recommended to do this routinely. It is only as needed if your baby, for whatever reason, is having slow weight gain, is not completing a feed at the bottle, maybe due to some kind of oral restrictions. The baby may have a tongue tie, lip tie, other oral issues happening, and you're waiting to have those things addressed. So now you're in a space where you're needing to follow up a feed with pumped milk, but this should not be done routinely unless recommended to do so, because it can cause your baby to have some digestive problems or overeat or I'm sorry, gain too much weight. Donor milk, if you have any health concerns or your breast milk is unavailable, there are many moms in the community that will donate or sell their milk to those in need. Wet nursing is also an available option, a viable option. So these are things that you want to investigate as well. I know, again, Facebook is a resource that I was privy to. I was helping to assist in sourcing milk for twins a few years ago. And Facebook was a very viable resource to solicit that milk. And people were very, very willing to just share, they call them bricks, bricks of milk at a time, which is what you could imagine twins needed. And we were able to source that for a little over a year for them. So that is a good option. And then formula, if necessary, it is considered safe to use formula in addition to breast milk, so you can do both. I've had many families, when I worked specifically for WIC, chose to do both. They would get their, WIC even had a package, or they had the full formula package, the breastfeeding and formula package, and then they had the full breastfeeding package. And there were many families that chose to do both, which you can, and your baby will grow and do fine on both. I always tell families that the breast milk will help your baby tolerate the formula better. And you can limit the risk of some of the side effects that we typically see in babies that are exclusively formula fed, like the ear infections and the digestive issues, the gastrointestinal issues that you tend to see, the GERD and the spitting up and all of those things are minimal when you have babies that are both, that are still receiving some breast milk. Okay. Paced bottle feeding. This is a great one. Let's see, is this a video? We're going to click it and see what happens. Paced bottle feeding allows babies to have more control over the pace of their feed. This is a very important technique, I think, that every parent should learn that intends to use a bottle at any point during from the time the baby is a newborn upwards of, I would say, about 3 months or so. They need to know and understand how to pace bottle feed before the baby can hold the bottle themselves, which many 3 and 4 month old babies can do that. If you're the one holding the bottle, you need to understand how to pace bottle feed so that you don't overfeed your baby and cause other problems. Some of the issues we see that I mentioned with formula, hence the GERD and the spitting up, and the digestive issues, is caused by overfeeding them, and then giving them spoiled milk, because formula really has a very, 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 very short shelf life once it's opened, once it's made. Once you mix that powder with the formula, with the water, I'm sorry, you need to use it within 30 minutes or put it in the refrigerator. After about an hour, it's riddled with bacteria, and we're wondering why babies are spitting it up, right? So most cans will say after an hour, you need to discard it. But truthfully, after 30 minutes, bacteria starts to grow and thrive in that formula. So be mindful of that. If you are going to do both, or if you are going to introduce formula to your baby, you want to be very intentional about when you mix it up. When you open that ready-made, instantly, once air hits it, bacteria is introduced to it from the air, and it starts to breed and grow, because formula does not have the living antibodies in it that breast milk has. And breast milk shelf life, you can leave it sitting out in a room for 5 hours. You can leave it in the refrigerator for 5 days. You can put it in your freezer for 5 months, and it can go in a deep freezer for upwards of a year. Okay, so it's called the 5-5-5 rule. Remember that. Formula, cannot. 30 minutes. Need to throw it away. Don't give it to your baby. So PIC'L bottle feeding uses you want to use a slow flow nipple on the bottle. I was showing this one earlier, this lancinol. You want to use a slow flow nipple. You're waiting for feeding cues from your baby. You're holding the bottle at a 90-degree angle instead of tilted vertically. You're holding it more horizontally. And this feeding may help the baby to avoid nipple confusion, right? Going from the bottle to the breast, for those of you who decide you want to do both. Even if you want to do both, I always encourage families to wait, give it about a week, maybe even 2 weeks before you introduce that bottle. You want to make certain that the baby understands and has developed the muscle memory and the mechanics of breastfeeding, because introducing the bottle can throw off their oral mechanics, because it's very different. It's very different from breast to bottle. And so it just depends on the child, depends on the infant, on how readily they can go back and forth. Okay. So let me have another video.
Hi, welcome back to Prenatal Genie. I'm Ginez. I'm a nurse lactation consultant, IBCLC, and I share breastfeeding tips on this channel every week to support your breastfeeding goals. So be sure to subscribe and hit the notification bell so you don't miss any of my future tips. In today's video, I am going to talk about PIC'L bottle feeding, and I'm going to demonstrate this technique to better assist you in bottle feeding your baby. PIC'L bottle feeding is a feeding technique that allows your baby to be in control of the feeding and allows baby to only consume what baby needs at that time based on baby's size and age. So to mention a few benefits of PIC'L bottle feeding, PIC'L bottle feeding allows baby to go back and forth the breast and bottle feeding. So baby doesn't develop a feeding preference or a feeding flow preference when bottle feeding. A lot of babies, if you feed baby with a bottle too fast, then baby has difficulty going back to the breast. So that's why PIC'L bottle feeding is so useful and helpful for moms or families that want to do both breastfeeding and bottle feeding. Other benefits of PIC'L bottle feeding is that it allows baby to only take what baby needs at that particular feeding, and then in turn you will not overfeed your baby, and that will decrease the risk of baby developing childhood obesity because of overfeeding. PIC'L bottle feeding is a feeding bottle technique that anyone that's going to be feeding your baby should learn. And like anything new, it might be a little bit awkward doing it, but as they practice, they will feel more confident PIC'L bottle feeding your baby. So that may include your partner, your grandparents, child care provider. So very important to communicate that this is the way you want your baby to be fed. Something that I want to mention before I demonstrate the technique is that ideally you want to wait before you introduce a bottle because you want breastfeeding to be well established. You want to make sure you and baby are breastfeeding well, there are no difficulties, and then between weeks 3 and 6 is the best window to introduce a bottle to a breastfed baby. So in terms of bottles, so you want to pick a bottle that is comfortable for you to hold, but most important, you want to make sure that the nipple that you pick for baby is slow flow. It's very slow flow. So you want to make sure that when you flip the bottle, there's nothing dripping. Okay, if there's milk dripping, the flow of the nipple is too fast, so it's not good for baby. Another thing that you want to make sure is that the material is soft, because breast tissue is soft. And then, you know, you're not going to find a bottle that is exactly the same as your breast, but you want to make sure you pick something that's the closest. So you want something that is soft and pliable, and you want the shape of the nipple to be a gradual slope. You don't want a short nipple and then a big base. No, you want a gradual flow of in shape of the nipple that you pick for baby. So when you pick a nipple that has a slope shape, it allows the baby to have a deeper latch. Okay, so you want the baby to take as much as the nipple inside the mouth, and for their lips to rest in the wider part of the nipple. So now let's cover the steps on how to PIC'L bottle feed. Okay, so the first thing you want to do is you want to feed baby when baby is hungry. When you see that baby is showing early hunger cues, that's the best time to feed baby. You don't want to follow just like a clock, you know, every 2 hours, every 3 hours. You want to do it when baby is hungry. And if you want to learn more about hunger cues, you could check my video on the best time to feed baby. Something else that I want to mention is when you PIC'L bottle feed, so slow flow nipples only have one hole, right? And that's all that needs to be covered, okay? The whole nipple doesn't have to be filled with milk when you PIC'L bottle feed, okay? You just need the tip to be filled with milk, all right? And then you're gonna hold the bottle horizontal, parallel with the floor. And the second thing is you want to make sure you wash your hands. You want to make sure your hands are clean before you're handling bottles and baby. Next, you want to make sure that you hold baby upright. Very important. We don't want to feed baby on their back, okay? We want to have baby upright, and you could support baby's body with your upper arm, or you could rest baby on your lap. Then what you want to do is you want to hold baby, right? If you're holding baby on your lap, you want to hold baby's neck, and or if you're holding baby here, you want to do it like this, right? And what you want to do is we want to mimic breastfeeding as much as possible, okay? So what we're going to do is we're going to tickle baby's upper lip. And when baby opens wide, just like when baby breastfeeds, then we're going to put the nipple in baby's mouth and allow baby to pull the nipple inside their mouth. Just make sure that baby takes as much as the nipple in their mouth as possible. We don't want baby to stay just on the tip of the nipple, because that means that when baby goes back to the breast, that's what the baby's gonna want to do, stay on just on the nipple, and that's not proper breastfeeding. Okay, so we want to make sure that we tickle with the nipple of the bottle, we tickle baby's upper lip, and then when baby opens big, then we put the bottle in the mouth, and baby's gonna draw in the nipple inside their mouth. Okay, and then all you need to do is hold the bottle horizontal, parallel to the floor, right? Baby's gonna start sucking on the nipple, and then we're gonna fill the little hole the tip of the nipple, and baby's gonna suck and swallow, and we're gonna allow baby to swallow for about 10-15 times. And then after that, we gently move the nipple back or the bottle back, and you could move baby upright, a little bit more upright, and give baby a break. Okay, here baby is going to breathe and take a break. And then when baby is ready for more, baby's going to start suckling again on the nipple. You can let baby suckle for two, 3 times, and then gently again, we're going to fill the nipple or just the tip of the nipple and allow baby to swallow 10-15 times. Okay, and then we're going to bring baby back upright and tilt down the bottom. Give baby a break again, and when baby starts to suckle again, starts to suck on the nipple 2-3 times, then we're going to fill the tip again. Okay, and this is going to continue just like this at this pace. Now halfway through the feeding, what you want to do is you want to give baby a break, and you want to burp baby. You want to burp baby, and then after you burp baby, you want to switch side. Okay, this allows for stimulation and for eye muscle development for baby. All right, so make sure that you give baby the opportunity to bottle feed on both sides. And again, we're going to start the same process. Tickle baby, wait until baby opens big, and then allow baby to draw the nipple in. Fill just the tip of the nipple. Allow baby to swallow 15 times, and then bring the baby more upright and lower the bottle. Give baby a break to breathe, and when baby starts sucking on the nipple again, then you're gonna tilt baby back and fill the tip of the nipple again and allow baby to swallow 15 times. Okay, so it's gonna get to a point where you're gonna tilt the bottle down and baby is not going to suck again. And that's your baby's way of telling you that baby is done with the feeding and baby is full. So we need to respect that. And then at that time, we want to burp baby again. And even if there's milk in the bottle, we don't want to force that into baby. Okay, we need to respect that baby is telling us that baby doesn't need any more at this time. Okay.
Okay, so that video, I think she gave an excellent description of PACE bottle feeding. I hope it helped you understand a little bit better of how to do it. Like I mentioned, I think it is very important that every parent parent understands how to pace bottle feed. Bottle feed, whether you breastfeed or not, if you intend at any point to give your baby a bottle, then you want to understand how to pace bottle feed. So that video link will also be shared in the contents below. All right, so we're going to chat a little bit about clogged ducts and engorgement. I mentioned the milk ducts. So the clogged ducts and engorgement is usually a result of missed feedings, as I mentioned in a slide previously. Tips to avoid engorgement: feed baby according to their hunger cues. If you are pumping, be sure to pump according to a schedule. I don't think we touched on hunger cues and feeding cues. They're very, very simple. The first cue that a newborn baby will give you is, most cases, they wake up. If they're not overly dressed and overly warm, and as a rule of thumb, your baby only needs one additional layer than you. So if you have your baby on a onesie and it's summertime, it's warm in your house, and you're sitting and you have on just maybe a set of pajamas, your baby maybe only needs a receiving blanket to be wrapped around them alongside the onesie, or an all-in-one and the onesie. They only need one additional layer than you. So they don't need on a onesie, a all-in-one, a receiving blanket, and a blanket. Those babies typically will oversleep beyond a feed, and then when they wake up, they can be inconsolable because they're so hungry that they're having some of those hangry symptoms, right? So first sign of a newborn that's hungry, typically they wake up. The next sign you'll see is they tend to look around. They're searching for you, really. They're rooting. They're doing this rooting thing where they're turning to the side, and then they start to suck and nibble on their hands. All of that's rooting. The next sign they usually would give you is the crying, right? So if you miss the waking up, sometimes babies will wake up and go into quiet alert. They'll wake up and just kind of stare around, and they're just staring and looking, that quiet alert phase. And then they'll start rooting and then crying. So it just depends on your baby. Get to know your baby, understand what their individual feeding cues are. But this is general newborn behavior that we see for them when they are hungry. Okay, so again, tips to avoid engorgement: feed baby according to their hunger cues. If you are pumping, be sure to pump according to a schedule. So if you are an exclusive pumper, you definitely want to have some kind of schedule that allows you to stimulate your breast every 3 hours. 2 to 3 hours, you need stimulation at your breast, day and night, if you want to maintain your milk supply. After about 2 weeks postpartum, your body goes into that supply and demand phase. So whatever demand you're putting on your body will determine how much milk you're producing, right? Many people are misled by their transitional milk, which usually comes around 72 hours after birth, and it's usually abundant for many people. And they think this is going to be their milk supply for the duration they commit to breastfeeding. And then about 2 weeks out, there's this massive drop, and they're shocked, and they're coming to see some kind of lactation professional. But typically it's going to be rooted in how often were you stimulating. Many parents want to breastfeed during the day and then let dad just bottle feed at night. You can totally do that, but it will impact your milk supply. Just know that. Tips to relieve engorgement: warm compresses, manual expression of milk, basically expressing it by hand. It's just a little bit more comfortable when they're engorged to express that milk by hand, and instead of the pump, right? Because the pump sometimes is not always as effective. Results of prolonged engorgement include mastitis. Mastitis is a clogged duct. So imagine one of these ducts here just did not get relief, and the milk just sat there for, I don't know, an insignificant period of time, and it started to go bad. It started to spoil. Let's think of it as spoiled milk left on the shelf, right? And that milk becomes infected, and that whole duct becomes now inflamed and infected. You want to see your own, your midwife or your OBGYN and receive an antibiotic for it. It varies in its severity. It can be a mild case of mastitis where you can just take ibuprofen and hydrate and rest because it does onset with flu-like symptoms. And then there's mastitis that is more serious, where you need to have antibiotics because, as any other infection in your body, it can go sepsis and cause you to be, really, really ill, even hospitalized. So it's avoidable. It's just caring for your breasts. You want to care for your breasts and make certain that you're giving attention to any tender spaces or any lumps that you find abnormal. I'm gonna say, because breastfeeding can be very lumpy, can cause very lumpy breasts. The lumps I'm talking about are those that are very tender to the touch. They're sore and achy when you touch and press on it. Okay. It onsets with a low-grade fever and fatigue in some cases, but you, believe it or not, you can still breastfeed. It's recommended that you breastfeed because baby is going to help alleviate the clog. It's going to pull that milk right on out of there and create space for that clot, that duct to start healing, right? So be certain that you're feeding on demand or you're pumping or giving your breast some relief to keep the milk flowing. That's the takeaway here. Sore and bruised nipples. Some of these things, again, they can be avoided just by caring for your breasts. The most common cause of sore bruised nipples is improper latching. We discussed that earlier. It's best to seek support from a lactation professional to help correct the latch. Because if you don't correct the latch, then it's going to cause more pain, right? So if you're dealing with sore or bruised nipples, one of the ways to prevent that, again, is even seeing a lactation professional or some kind of breastfeeding support before you even leave the hospital, right? You could see somebody there or if you have a home birth and a midwife, then that person is usually trained to support you in that. Many doulas are trained in lactation support. So you want to have an extra set of eyes if you're unsure about the latch. Get an extra set of eyes on it. Your nipple should not be damaged from breastfeeding, right? It shouldn't be swollen and red and peeling and cracking. Those things are signs that the latch is wrong. So you want to have somebody to help you fix that. So here's some tips to help with the healing of any bruised or sore nipples. Be sure to break your baby's suction, as you see here in the picture, before removing them from your breast by inserting your finger at the crease of their mouths, right? You want to insert that finger to break the suction. And sometimes you can even hear that type of sound when you put your finger. That's how strong. Listen, your baby's using over 30 oral muscles to latch onto your breast, stay latch and extract milk. That's a lot. So you want to be certain that you are able to break that latch and protect your nipple. Don't just pull them off of the nipple, right? So apply freshly expressed breast milk to your nipple. So after each feed, get in the habit of just expressing a little milk, rubbing it in on the nipple. That's antibiotics, antimicrobials, antifungals. It has all of those healing properties in it to help support your nipple and keep it healthy. So you can express that on there, and we also can use warm, moist compresses on the nipples. But I love a good protective layer of lanolin or any other kind of healing nipple salves and ointments they have out there to help protect the nipples. So get in the habit of putting something like that on there at least a few times a day if you're an exclusive breastfeeder. And then offer your baby short, frequent feeds. If you're dealing with sore, bruised nipples, you want to minimize them latching on. Minimize the time that they're latched on so that the breast can get a break. And maybe even pump that breast that's very sore and breastfeed on the side that's not. That's my typical advice to folks that's dealing with a nipple bruising, is to give it 24 hours. Stop breastfeeding on that one. If it's the right side, let's just pump the right side and breastfeed on the left for 24 hours. Give that right side time to heal. But this is in conjunction to correcting the latch. Otherwise, we're going to have the same trauma on the left that we have on the right. So correcting the latch is the key to avoiding sore nipples. We are nearing the end, y'all. Hang in there. All right. Low milk supply is another one that I mentioned earlier that many people um, encounter, during their breastfeeding journey for various reasons, whether it's skipping and missing feeds. That's the most common culprit. As it says here, the most common cause of low breast milk supply is disrupted feeds or inadequate stimulation. Also, menstruation. So many women do have a return. Their moon cycle will return about 6 to 8 weeks after birth. Very, very common nowadays. If this is your story, then you want to be more intentional about your nutrition, your hydration, and resting, because both of these processes rely on our blood supply, right? And so if you're if you're menstruating or your moon cycle is there and you're losing blood, and then you're breastfeeding, which is produced by your blood supply, many women experience low milk supply as a result. So you want to be intentional with your prenatal vitamins. This is a great time to introduce some iron for those days that you're menstruating, right? And really resting, being able, hopefully you have a job or something that allows you time to slow down. If it's possible to take a day, whichever is your heaviest day of flow, if it's possible to take that day off so that you can rest with your baby, that would be my suggestion. Self-care is important. Other causes can be underlying medical conditions such as diabetes, polycystic ovarian syndrome. PCOS is very, very common nowadays, and it is hormonally driven. And so those hormones associated with PCOS sometimes can disrupt the hormones needed for breastfeeding. So it's ideal to be mindful of that if that is your story, so that you can take your medication or address it accordingly. Hypoplasia or underdeveloped breast tissue. This is also, I will be honest, is more common amongst Caucasians or white people than it is us. In all of my years of working with families, I've never met a melanated person that had hypoplasia, but I have assisted many white women that dealt with hypoplasia or underdevelopment of breast tissue. More often, I see melanated women or Black women specifically have a breast reduction, right? And so in that, sometimes they're removing more than fat. Sometimes they remove those ducts and glands. This depends on the integrity of the physician or the surgeon. So if they did the procedure with great integrity, then they would have minimized damage to those ducts and glands. If they did not, then they may have removed some of those ducts and glands, which would cause you to not have enough tissue to produce enough milk. That's an underlying medical condition. So tips to increase milk supply, as I mentioned, increasing hydration, eating more fruit. Definitely, always. We need fruit. Fruit is a true hydrator, more so than water. Water is a cleanser. Fruit is a hydrator. Coconut water. I'm not a big fan of it, but Gatorade, just your athletes, they don't give them water when they play in sports. They give them a version of Gatorade. It's typically not the version we buy in the stores, though. Rest. Skin to skin with your baby, and you can even consider a power pump session. And I'll let you do your own research on a power pump session. We won't go into that detail at this time. Okay, troubleshooting breastfeeding issues. If you are ever experiencing issues related to breastfeeding, it is advisable to reach out to a lactation professional. These individuals are trained to counsel and troubleshoot lactation issues at any stage in the breastfeeding journey, right? This would consist of your breastfeeding peer counselors, your certified lactation counselors, or your certified breastfeeding specialists, and your international board certified lactation consultants. I want to also add in there your doulas and your midwives. They are also really good at supporting you in breastfeeding. This is a picture of my book. It is on my website, as I mentioned earlier, loveandtouch.com. LOVEN, touch.com. This book has many, many tips in there for addressing breastfeeding concerns, breastfeeding problems, and just helping you have a overall good breastfeeding experience. Ideally, that's why I wrote it. So, from here, good people, I think that would be the end of this presentation. If you have any other questions or concerns, you can reach out to us at info@gabdn.org, gabdn.org. That is our website. You can reach out to us directly there. Please check out our directory if you are searching for a doula or another perinatal professional, such as a lactation professional, like we talked about here, or a mental health therapist, a childbirth educator. We are working to build the largest perinatal directory for Black and Indigenous professionals in Georgia. And this has a dual purpose to help you find them and help them find you, right? So if you are a Black perinatal professional, we encourage you, and you reside in the state of Georgia, we greatly encourage you to register your services on our website so that other families can find you, right? And vice versa. If you're searching for one, please visit that directory as well. So with that, good people, I'll bid you peace and blessings. Hi, I'm Miss P. I want to introduce you to PIC'L. No, not this. I'm referring to the Pregnancy Information Circle and Learning Childbirth Education Series taught by community doulas. Come learn with me about pregnancy, birth, and beyond, one bite at a time.